Now, all right. So everybody asked me about the exam. Not done yet. I still have a few more students, uh, a couple ones to grade, and I'm anticipating either tonight, more likely tomorrow sometime, uh, that I'll be able to start getting that together and posting it. It will say on your blackboard, and you'll get a notification, of course, exam one with scale. And it means I will have whatever that letter grade is, it will be the letter grade. The difficult part, always, honestly, is the best policy. The exams weren't very good. So my difficulty right now is I never, when I look at them, I have to look at them a couple of times to figure out what would be an appropriate scale for the class and how to best make it so it's so you're aware of what your level was and not so disappointed that you kind of lose hope. I don't like that. I mean, I don't want people to feel like, oh, they can't do anything here. So it's a challenge without that card. So it's not so much the top end. People who did well are going to get a good grade. People in that, when you start getting to that, the C and below character, that's where it's hard to adjust the scale. So I'm working on that. For some of you who've had me before, not in the lab really wasn't justified, but those who had me for lecture had a much better idea what my lecture tests were than those in the lab. And because we have a mixture of that in the class, and I didn't mention this to the other group, that's why I have to be fairly reasonable and to some extent generous. It's a one-time deal. It's like on TV. If you order right now, one of those, if you order right now, we will give you this. Yeah. So that type of a thing. I should have been one of those guys, you know, one of those hawkers on TV. Bring back the Ginsu knife. No idea what I'm talking about. OxyClean. No, not helping. I give up. All right, enough of me going into things you don't know anything about. So basically our focus today is germicidal agents. I don't know if we'll get quite as far as we did with the other group. That's okay, because it's not hard to remember where everything is. So I did want to go through kind of where we ended. We talked about the heat. I don't recall me making a big deal out of it cold. I wanted to mention a couple of things before I moved on to the germicidal, because we have to do the ionizing radiation, ultraviolet. Okay, cold slows it down. And so whether they're refrigerated or frozen, they can stay for long periods. Things that are more effective, that really are still physical. Drying is a very physical way. That's done for forever. People they still do them. You buy sun dried tomatoes. You buy a lot of things that have dried. A lot of things are packed in salt. Effectively, that's a means of drying them. So it's and the preservation is important. The best combination is freeze drying. A lot of things we use in the laboratory come freeze dried. Freeze dried means that you're simultaneously freezing and pulling out the water. The big problem with freezing anything is water inside the cell crystallizes. That's what water does when it freezes. Crystals are sharp and irregular. And what they do is they puncture the membrane, and that's why you get something called freezer burn. It's less due to microbes, it's much more due to how you put them in the freezer. And a lot of us do the same thing, and I do it all the time, and I know better. Is first of all, they only put it in one zip top bag, not two. They never label it and put a date on it, so they have no idea what it is or when it was in there, and they just toss it. And that's not the way you're supposed to do it, because that damages and has a greater tendency to create crystals. I mean, if you look, you go to the grocery store and say individually IQF, individually quick frozen. What they do is they have big industrial freezers. They put like crab cake, individual units, make them, cook them, freeze them in, so they don't touch each other. Once they're frozen, now you can't hurt them. Put them in the bag, get them ready to ship to you, so you go to your local grocery store and get them frozen. That's so there's some nuances to that, particularly in food science. Really, so it's the crystals, and dry and lyophilization, fancy term for freeze drying does that. Okay, radiation. It's short, not doing the physics. This is what you and I see, visible light. Everything we're looking at is visible spectrum. It's all about wavelength. That means the distance between these peaks. As the wavelength gets closer, the energy is more powerful. So it's not that they don't have other aspects. Longer waves, infrared. That's been used in physical therapy modalities a lot. Okay. Microwaves. First of all, microwaves, other than microwaves are a great tool that you have, whether it's in a dorm room or in your house. Okay. They're obviously useful. They're also part of the basis for what we and I have here, cell phone technology. So there's a lot, and then radio waves themselves, whether you like listening to what we call terrestrial radio or satellite radio. I'm a satellite radio guy. I've had Sirius since they started. So moving on, this side is where it's useful as methods of control for microorganisms. It's used all the time and surprises people. There are two categories. Ultraviolet, which is right after the violet area of the visible spectrum, is very useful. It has its limitation. It's used a ton in dentist's office. It's used a ton in water treatment. Okay, its big problem is it doesn't penetrate real well. And if you have something on top of it, like this is what I was trying to use ultraviolet on, and I put a postcard on it, it wouldn't get through. You may or may not do an experiment with that in a lab, because we have one that we will sometimes incorporate in the lab. You can ask Dr. Dress, whoever's doing your lab. They're planning to do the ultraviolet experiment. Ultraviolet, it doesn't kill, it just stops things from growing. So what it does is it affects DNA strands directly, and what it does is, you will see shortly, it creates something called a thymine. That's the A's, the G's, the C's, and the T's of DNA. That's because you only have 4 letters. Every so often you have 2 T's close right next to each other. Ultraviolet light links them together, and if you think of DNA as a zipper that opens and closes, zips like this and unzips, it creates damage to that zippering mechanism, like someone got stuck in there. And when you try to open and close it, just won't. It gets stuck. And that means it can't grow, can't reproduce. So it's useful, but and in food, in a restaurant, you'll cut everything up first thing in the morning, put it out under ultraviolet light, and let it stay there, room temperature, because that's how you want to cook it. With the ultraviolet light will limit for a substantial amount of time bacterial growth on, onions, carrots, celery, mirepoix, whatever you're cooking, for you fans who cook. Right? That's the first nugget. Ionizing radiation, X-rays, and gamma rays, different. They actually cause DNA strands to break. They enhance the amount of toxic derivatives of oxygen. They are nasty. Okay, but they're used a ton more than you think. In the lab, if you were with me in lab and we put a new blade and I opened up that foil pack, you just reach, sterilize with gamma rays. It's put in, it's sealed, sterile, it's irradiated. Everybody say, oh my God, if I touch it, my finger's going to fall off. It's going to be a bad scene from Oppenheimer. And the reality is it's not, because they make sure that the surface radiation has dissipated, and there's a lot of foods, there's a lot of consumables, and not just supplies for a hospital that undergo irradiation. It's very effective. It's comparatively inexpensive. So here's the thymine dimers. They cross-link these adjacent nucleotides, and if they can't separate the strand effectively, it impacts reproduction. Filtration is a consistent part. It's one of the classic ways of physical, and we use them all the time. The ones you use a lot from a medical perspective are air particle. They're called HEPA or HEPA, as you could see. High, and they really don't sterilize. Theoretically, you could, if you know what you were doing. So things like that. Microbes can't get through, lots of different things. Uh, One of the most effective ways, if you have a pool, is called diatomaceous earth. Very, 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 very effective way to, if you have a filter that's constantly going in your pool, and pore sizes, and the HEPA, high efficient, or HEPA, however you want to pronounce it, high efficiency particulate air in hospitals, that's there in a room like a tubercular patient. Those particles they're coughing up stay in the air. You have an exhaust fan with a filter pulling them out. And even then, if you're going into that room, you have to wear specialized protect, like those NP95, those masks, those thick masks. You learn all about that in what's called PPE, personal protective equipment. So it's nothing new about this, but it's there. So liquids and things like that were filtered. So a lot of times we use that, not sterilizing, but for years they've had cool filtered beer, which was effectively pasteurized more or less by that without the heat. Water purification is also part of it. Here's the name for those filters that are there, and they capture stuff. That's what we have to have. Osmotic pressure, that goes back to what we do. Another word we use for this is curing. We were just talking a little bit about that before. Salts and sugars suck out the fluid, because you guys were mentioning hyper and hypotonic. Hypertonic is great when you're dealing with bacteria. They can tolerate the extra fluid, not the less. Sucks it out, they undergo plasmolysis, the membrane ruptures. And so it's really useful. And then you can add flavor if you want to do that. And pickling means acidity. Basically, you're denaturing proteins with acidity. Smoking is slow amounts of heat. And there's hot smoking and cold smoking that's used. And again, drying food's been used for forever. When they salt them, effectively, they're curing them. And also, they'll put them on slabs. The old days, put them out in the sun on slabs, meats, they dehydrate them in that regard. And then they replenish them with water. So just to give you some ideas, there's a lot of versatility with this, and they still have impact. Okay, which moves us on to chemical control. And I'm going to go to the other PowerPoint shortly, but I just wanted to introduce it this way. So chemicals imply chemicals, they don't imply liquid. Okay, and they can sterilize and be called sterilants, where they can just be used on surfaces and called disinfectants, and they can be used on living tissue like skin and called antiseptics. There's some overlap, but they're in no way really interchangeable terms. And if I had one thing to say about it, there's no one perfect way to do it. If there's one way to do something, everybody would do it. If there's the best way to do it, we all would do it. Because you would hate to ask, why did you do it this way? This is the best way, isn't it? And there's a couple of those that exist. We'll even see one in this year. And so a couple of definitions. When you hear about something that's aqueous or in a solution, it means whatever the chemical is, it's dissolved in at least 50%. It's half or more water. If it's a tincture, and we still use tinctures today, though much less frequently, it means 50% or more alcohol, typically like rubbing alcohol. Those are older terms I'll talk about historically, and because there's a lot of relevance to them still. These are desirable, but there's, again, no one thing. Should they be quick? You don't need to use a ton of it. Can they be stable? We dissolve them. Do they clobber everything? Do they work on inanimate surfaces? Does it stay there? A big one, inorganic. Most of them are organic matter. Having anything from blood or fatty tissue on it is a big problem. Constantly battling that problem. Almost everything before you can treat it has to have that stuff removed. There's some things that still work, but they have other subset of problems. We'd rather they weren't corrosive. We'd rather they didn't stain. Believe me, you'll get used to stains. If you're working in a hospital, blood, iodine, other unpleasant substances. Did I tell you my wife's hair anecdote? I should. My wife worked for about 10 years at a nursing home, both as an aide and as a nurse. And, it was hard because you had, it's like a lot of people, you need two people, somebody lift and hold them up, someone get on the potty chair. Okay? And so somebody was holding this elderly lady up who had to go. And my wife's getting under there with the potty chair. You guessed it, she let go. Yeah, an official. Thankfully, the lady she was working with, they got the other lady situated, of course. Raced her into the shower and got everything off as quick as possible. She goes, it was the scariest moment of her life. I mean, it's like, oh my God. So be prepared. I am not telling tales out of school. This has happened to anybody who works around people. You get all sorts of stuff on you that is not necessarily pleasant. Okay? This is most of you, this is the business you have chosen. Godfather 2. Okay. So all of these types of things, this is all the considerations. You may not think about affordability or availability, but in medicine and industry, you do. I mean, it's great to have good stuff. Can we get it? Can we afford it? Okay. I could, to me, it's this high level is what we try to use. We always try to use the most effective stuff. They don't always have to kill endospores. If they do, they're implied to be a high level germicide. Germicide is kind of a garbagey term. And if they're not killing endospores, they clobber almost everything else. Intermediate and low, we still have uses for, because in everyday, you're not going to use a corrosive agent in your home if you can help it. You're not going to use something that would have toxic fumes to inhale if you could help it. You wouldn't have something that's going to make your skin break out. So there's a whole, and typically those are intermediate or lower level agents. So I don't ask a lot of questions about that. And these are the factors. And the best assumption to make is really contaminated by everything. And whatever you want to take the best approach to get rid of everything that potentially could be on there. So there's the factors may be there. Your approach has to be for the task. Am I doing something for an operating room? Am I cleaning up the kitchen at home? And there's different levels of what you have to achieve. And this chart, I don't think is terribly helpful. That's why I'm going to go to the other PowerPoint, because I'm more comfortable with those slides. But it gives you an idea about time. And as you can see, even chlorine that we hear about so much, I mean, if we're trying to get rid of protozoan cysts, not even talking about endospores, we've got 2.5 hours of exposure. Okay. Alcohol. There's not a whole lot of stuff you're going to put alcohol on. You're going to drop into a basin of alcohol for 10 minutes. It just doesn't. So it's not really a good choice for some. So all of these are about why we make a particular choice. This quaternary ammonium compounds, known as quaternary ammonium salts. As you can see, you need 10-minute exposure to basically destroy an organism. It should surprise you then that this is the agent. Every time you use antibacterial pump soap, that's the agent. Why? Because it's useful in what it does, and if you get it on a surface, you'll see that again. When you've got those Lysol wipes, don't have Lysol in them. Those Clorox wipes don't have Clorox in them. They have quaternary ammonium salts because you're going to wipe on your hands, put your hands on your shopping cart, and what are you going to grab? The first thing when you go into any Giant Eagle I've ever gotten into, produce. Unless you want to have chlorine on your tomato, or on your lettuce, or on your broccoli. I don't. Oh, here's a great apple. Bleach. Quaternary ammonium salts. Food industry wipes down tables with that. And we'll get to the poison gas initiative. So without any further ado, that was the Cowan PowerPoint. You have this Chapter 5 PowerPoint, which is from Nestor, that I'm going over here. This is this one, whatever it says up there, I can't read it. Chapter 5, Lecture PowerPoint, PPTX. And here's the same unit. So again, they have all the different levels. I'm not worried about it. First thing. Remember, disinfectants, Sterilants are used on inanimate objects. Their strength implies that they will have impact in the environment. They are controlled by and tested by the EPA, Environmental Protection Agency, whereas antiseptics are used on you. They technically fall under the Food and Drug Administration, the FDA, the one that says it's okay to have a certain pharmaceutical. Yes, we can use this antibiotic. Yes, this vaccine is safe. So, different things. When we talk about living things, FDA, inanimate things are the process of sterilization and what impact it, because those agents inevitably have environmental impact. They're so strong. Not all, but they're very strong. And this is very much that same chart that you saw before. Okay. Basically, how toxic is it? I mean, am I going to use it if the minute I open up that jug, it's like, oh my God, I can't breathe? Okay. Organic material. You can't use on certain stuff. You'll see when we use certain devices in surgery, they have to be treated differently. And a lot of times we might have an adapter we can sterilize that will pass sterilely to whoever is doing the procedure. And then the other half will go into a piece of machinery that's non-sterile. That's very common because a lot of times we'll do things on, you do endoscopy, colonoscopies, and things like that. And you can do them under visualization. You'll be looking at a TV monitor rather than having to look through an eyepiece of the scope, which is difficult. Residues are there. And again, all of these other factors that are there. So we'll look at that. And there are things that are environmentally friendly, and it depends on what you are. If you're using it at home and you have somebody with asthma, you're going to want to be careful and that type of thing. So I will buzz through to the end and come right back to start with alcohols. I want to show you where all of this is found. We don't do this by the name so much as the family. The families, alcohols, all alcohol-containing substances, aldehydes, we'll get to them, biguanides, very important, ethylene oxide gas, which is a category zone, that's the poison gas I talked about a little bit previously, halogens, chlorine, iodine, fluorine, bromine, we use them all. That's where they are. Remember that category here, periodic table? It's a science classroom. I have an imaginary, you can see it, I put helium up there. See He and H? It's right up there. So we have to have a periodic table. Those are inert, helium, neon, krypton, argon. Okay. And over here you have, things like bromine, fluorine, chlorine, bromine, iodine. Periodic table. Science. We'll get into those. Metals, more important than you think. And then these other guys, ozones, hydrogen peroxide family, phenols, and back again to the quartz, or quaternary ammonium salts. So I wanted to give you that to show you the way my typical questions for these are. I'll give you a little description of what it does. This substance evaporates rapidly and works rapidly. And it's used topically, but it has limitations. It is blank. And the answer is alcohols. So alcohols are more commonly used now than ever. And you can see it right on the wall over there, hand sanitizer, which is a gelled alcohol. That's all it is. And we've been gelling alcohols forever. If you have a little home stove or something, or you went to a big party and had a chafing dish that they kept heated, they had a little can called Sterno underneath it that they lit up. You know what I'm talking about? Okay. And then you go to a wedding and they're keeping the food hot, those nice metal things you lift up, gelled alcohol. That's what they use. The beauty of it is it evaporates quickly. So when you clean your hands, it's very effective if you don't have a major contaminant. Okay, if you haven't gone to somebody who has, oh my God, something terrible. And all you have to do is Do that for 30 seconds on your way out and into the next patient, and you're done. Everybody's happy. There's like that. You're not dripping liquid on the floor. There's not a paper towel you drop something could drip on. Okay, it's not over your clothes. It's the easiest thing in the world. Good news. And it's limited, but it's effective for what it is to do, which is make your hands clean enough to touch or interact with somebody. The other side is it evaporates quickly. So if you're putting it on your skin in 15 seconds, it will get rid of enveloped viruses and a few bacteria. But anything hard to get rid of, it's not going to touch you. You'd be just as far at that alcohol wipe to give an injection. You're just as far ahead to use soap and water and a clean, like a 4x4, even a clean paper towel. It will be just as clean because it goes away in 15 seconds, right? That's what it does. It probably works more in membranes than anything else. They talk about it being a disinfectant. It really isn't. It's much more of an antiseptic because you'd have to stick it in alcohol for 20 minutes or 10 minutes is not really that feasible because it have more of a negative effect in that way. So it's much more as an antiseptic and less so as a disinfectant. It's cheap. It evaporates, so it's not problematic environmentally and all that. And yes, some materials are incompatible. And again, we utilize it to dissolve other things more so historically as what are called tinctures. So again, that's an important number. Just remember, a tincture means it's dissolved. Majority of it is dissolved. It's dissolved in something that contains a majority of alcohol rather than water. That's it. So I mean, I'm not underselling it. We are a lot more cognizant of hand care than we ever were, and that's become a great alternative. And people have it everywhere. And it's you wouldn't bat an eyelash if somebody on their way out the door here got some of that in their hands on their way out. Would you? No. Hey, you'd be happy. Okay. Because, there's a tacit acceptance. Yeah, they're taking care of their hands. It doesn't, if you're on a C. diff patient in a hospital, you can't use it. It doesn't work. It's not the mechanical action and then the use of running water with soap, preferably. Or what does it? If you want to do hand sanitizer after that and dry things off, go ahead. But there are certain rules that you must follow depending on the organisms that you have encountered. First one on the list. One you don't even think twice about it because you probably haven't used them. Aldehydes. Aldehydes have been around forever. They're a common, relatively easy to produce organic chemical. In my office for 20 plus years, overnight we would sterilize our instruments in glutaraldehyde. It was easy because it came in a little container that all you had to do is put it in like about maybe a half gallon of distilled water, shake it to sort of spread it around, and the trouble is overnight it would lose a lot of its potency. So every day you made up a new solution. So you got a 2-week supply. You got 14 or 10 little vials for 5 day a week. Put it in there. It's the first thing my staff did. Throw out the old one, make up a new batch, rinse everything out, put it in, take the instruments out that were there overnight. And they take the instruments out. They were in something called a Bard Parker tray, which you might see. You open the lid, the tray comes to the top. It's stainless steel with little holes in it. So the liquid will soak through, but it will drain off as you lift it out. You don't want to touch it because that stuff's nasty on your skin. It's corrosive. So once you let it drip dry there for a while, get some gloves on, get some clean, like a sterile towel that you open up and lay it on there and let it effectively dry off. And then, even then, put a little bit of alcohol to get rid of the residue because the residue can be nasty on a patient's skin. And we did that. 3 or 4 rooms having 3 or 4 sets of instruments doing that type of stuff. Yeah, and most of these work on proteins and denature them. It's relative. It is a sterile. There's no two ways about it, and it's a function of time. So if the office closed at 6, by 6 in the morning, they're good to go. That's the big problem. It's called cold liquid sterilization. Cold sterilization will sometimes apply to radiation. But when they say cold liquid sterilization, the biggest single problem, time. It's tough if you need an instrument right away. You can't wait 10 or 12 hours. So you have to rinse it off. They used something else that was less potent and less toxic, but it altered the skin color when people came in contact with it. So I don't know whether it's still used today. And what is still used today, and this is the first sort of what I call additional nugget on today's discussion, is formaldehyde. So 25 years ago in the lab, specimens came in a big bucket. You see some of the buckets in the A&P lab that had formaldehyde in them. These don't. The Carolina labs changed it. The smell was so nasty and toxic that you have to now, if you still have some, use them under the hood. It's functioning. It's that bad. So formaldehyde is the same stuff that we put post-op specimens during surgery. If you remove a mole that you want to test to see if it's cancerous, it goes in a little container with formaldehyde to preserve it on its way to get sectioned so you can see if whether it's a tumor or not, whether it's a cancer. That's what you do. So anything you take out has to be looked at that's legal. And that's where you have it most. Formalin solution, as you can see, is fairly concentrated in water, was a useful agent we used to use for topical things, for topical skin problems. Very effective, okay? All those things. And here's the big nugget. Vaccine. Biggest problem with vaccine is sort of the start of vaccine laxity and people becoming suspicious. And this is absolutely, and we still use it. My kids, when they were little, had this stuff. They used to use formaldehyde as a preservative. It's very potent in not letting other microorganisms. Okay. So they use that in a lot of vaccines. What it did is it stabilized the vaccine as long as it was either typically refrigerated and sealed. There's no problems during the shelf life. But you're injecting a toxin and a carcinogen. And that, even though this is not one that's been implicated, it's not a big stretch because who are you immunizing? I would think it would have a negligible effect on adults, but on a baby or on an infant, that's where a lot of this, and this is the chapter where we start to look at this and its impacts. So that's the first problem child vis-a-vis vaccines that you will see here in this unit. The second ones we'll get to, and I know we'll get to it today, is here, metals. And that's a big player as well. So let me make it clear. I am not telling you to distrust a vaccine that you have to take or a vaccine that you're going to give to, if you have kids or you want to have kids. I fully endorse the fact that they need to be immunized appropriately. It's important that they are safe. And it's just a little bit of research. And as you will see down the road, going to doctors who are willing to work with you. It's a different era than when I was a kid. We didn't have as many doctors. And the doctors basically they called the shots. It is a consumer-oriented society. If you go to a doctor who is not willing to listen to what you have to say and basically gives you I'm the doctor here, I make the decisions, here's what you do. Find another doctor. Hey, when I go into a doctor's office, particularly for a specialist, and I would do it with a pediatrician now, it's like, hey, think of this as an audition. Because if you can't work with me, and they want your business, it's very consumer oriented. And they all know that you can pick up on speed dial 1-800 call Edgar. And, Pittsburgh people, that's Edgar Snyder. And he'll be more than willing to listen to you. Because everybody is a PI lawyer, personal injury. Edgar's really a nice guy. Our daughters went to kindergarten together. That's how much I know. He's about 10 years older than I am. So he had a second wife, and he has older children. Moving on. Chlorhexidine. Oh, you'll like this. So I'm telling you about alcohol doesn't work and it's awful. Chlorhexidine is great. It's a perfect antiseptic. If you go today and somebody you know is in the emergency room and they wash their hands between patients from room to room, they all have a sink in between them. Those sinks have chlorhexidine soap. Chlorhexidine is kind of like iodine, particularly betadine. It actually works better when you mix it with soap. They're wonderful products. If you go to do a surgical scrub, you're going to have sponges that are sterile inside and have been preloaded with either betadine soap or biguanide, particularly chlorhexidine. You'll hear Hibiclens, Hexaclens, or chlorhexidine. They're all like that. Wonderful. If you had your wisdom teeth out, you had a dental procedure, and you had to use a mouthwash, chlorhexidine, because it doesn't irritate mucous membranes. You can put it on a catheter and let the catheter indwell. It is wonderful. So it has a long lifespan and doesn't have a lot. So it's really excellent. That's the good news. The bad news is it's not a sterilant. It's not. It's probably an intermediate level at best, but great for skin. To me, and studies for surgeons, when we use betadine soap or biguanide, or as you can see, chlorhexidine-based soaps, the chlorhexidine works just a little bit better. The distinction is, and how you know which is which, betadine is kind of like a brownish, brown, dark to light brown foam, and the chlorhexidine is sort of a white and pink kind of a foam. They have a slightly different color profile, but it's really good stuff. And so you'll see it a lot in dermatological products, as you see here. Mouthwash is comparatively common. And you hear from me the way I'm discussing it. It's the hand washing lab that I do. I still probably have some chlorhexidine sitting in that lab. I'll have to tell Dr. Dress about it. Okay, ethylene oxide. Ethylene oxide is no other way to say it, poison gas. When I started in practice, you could get, it looked like a metal box, size of a dorm room fridge, that had a little chamber, and you could buy cartridges that had this stuff. As you can see now, since it's unfortunately explosive, toxic, and potentially carcinogenic, you might be not surprised that we don't sell this today. It is by far and away the most common way that non-steam compatible items, a lot of disposables, needles, syringes, paper goods, gowns, drapes, gauze pads, Band-Aids, those sterile Q-tips you open up in the lab, all of those poison gas. A room roughly this size, maybe a little smaller, bunch of shelves, they stack it up. It's in a paper that the gas, which is very tiny molecularly, will penetrate. They fill it for however long it has to be. And as you can see here, they basically have to pump it out and eliminate it by forced air. In other words, pull it out, replace it with air over a long period. So it's a big process. So they do big patches. That is how it works. Once they've accomplished ridding it of the agent and getting it disposed or altered, then all you can do, you pack them up and put them in shipping boxes, and out they go. So that are extraordinarily important. It's a sterilant. It has that's its usage. Okay, endospores, because it is by definition a sterilant, penetrates. You have somebody's getting an artificial hip, artificial knee, they are sterilized in that. If you did not know, they're called sizers. These are made out of like a plastic type of component material that you can sterilize. That's if somebody's removing a hip, they'll have different sizers to determine which prosthesis, which new artificial hip. They don't open the artificial hip and they say, oh, we need them, whatever size number 43, for instance, because that's the sizer that worked best. And then the pharmaceutical sales rep, in this case, the sales rep for that type of material, will be in the operating room with a big suitcase, and inside he's got all these sterile packs. And he says, oh, here you go. And he hands it to the circulating nurse. And the next thing you know, they prep it, and then it goes into somebody's knee or hip or elbow or shoulder, wherever they're using it. That's how that works. So the Petri dishes you're using in lab, those big plastic bags that are under one of the things on the wall to the right as you enter, that bag is sealed, is sterile, ethylene oxide. When you open it up, it's no longer sterile, but the interior of the plastic Petri dishes is. When we pour those plates, we open them, pour the hot sterile liquid on them, close them real quick, so it stays sterile inside. We pour plates. I have enough time to do this last super important category, halogens. That again, the one surely the most ubiquitous and absolutely a disinfectant, not an insect. Okay, chlorine. Okay, chlorine, as you can see, denatures in sunlight, so it's an opaque container always. You do not need to use it right out of there. You dilute it. So typically about an ounce out of that to an ounce to roughly a gallon of water, 2 ounces to a gallon surely would be roughly a 1 in 100 dilution, 120 gallons. So however you want, an ounce and a half. Okay, put it into a container with a gallon container of distilled water, you're good to go. That's a really great disinfectant. Don't use it on stainless steel because it tarnishes it. For years, we've used it for drinking water at very low levels. That's part of the thing. Sometimes water has that sort of chlorine taste or smell, and that's where those Brita and Beer filters do really well. They kind of make the water. It's perfectly safe. It just doesn't taste good. You see, and there's certain things that still survive. So that's why water treatment is complex. It involves ultraviolet filtration, chlorine, ozone. There's water treatment facilities are environmental science and bio majors. They used to do a field trip there. I don't know if they still do it. Okay, they used to do a field trip for one of the labs. We're down to water treatment facility. So organic compounds can interact with it. That doesn't help. As you can see, carcinogens are possible, and there's ones that you can even use in the gas phase. That chloride dioxide. The difference is iodines. And iodines, again, they all seem to react with proteins. They could tell you it's an antiseptic. Iodines do not have a tremendous amount of killing power. So they're very unreliable. For years, it was tincture of iodine. When I was a little kid, the iodine bottle had a skull and crossbones. It was poisonous. And your mom chased you around when you scraped your knee to put it on there because it stung like anything. The problem was the alcohol was stingy, and moreover, the iodine. The iodine was released very rapidly. So the magic happened with another one of these products that's better with soap called betadine, and you use it today everywhere, ubiquitous. It's a mixture of a protein carrier called povidone and iodine. And what that does when they bond together, they betadine, and that protein carrier causes it to be released relatively slowly. That's why it doesn't hurt. And it's even better, like I said, with soap. So betadine solution, full strength, is not great to use on wounds. You may end up using some of that on wounds and maybe advise if you're nursing. Uh, I don't want to get into an argument. Again, I say, well, don't tell Dr. Stein said you shouldn't use that because it's tissue toxic. We've learned over time to dilute betadine solution, maybe 1 to 10, and then you can put it on for wound care. These two things called betadine wet to dries and saline wet to dries. You put a moist gauze pad and you tear it off the next day. That hurts. You're debriding, you're removing debris, but you're also killing the new cells. So we've learned with wound care that you need things to keep moist does better than dry. So ointments and things like that do better. But again, betadine soap, wonderful, used a lot. when we use betadine, even in the operating room to prep the skin, it's diluted to some extent. For the most part, we typically rinse it off with sterile water or sterile saline. So all of those are used. So it's a wonderful product. Again, the limitation is full strength on open wounds. It's the same is true for peroxide. It has a certain tissue toxic effect. If it's a new wound, you might use it. But if it's a wound that's open and trying to heal, yeah, it's trying to fill in, you might want to be a little more careful with that. So and again, that crusty stuff you see in the lab in your stain bottles, iodine crystals and iodine, they can grow pseudomonas, which are very nasty. So you got to be very careful. You have to change out those bottles a lot. We'll start with metals when we meet next time. Thank you. Oh, here's what it'll be sad.